Hello, everyone. It's Supercalifragilistic Moments with Dr. Eve. I hope that you are well. This is episode number 10. Yes, this is a very special day in the nation as we celebrate one of the greatest men of all time, the Reverend Dr. Martin Luther King, the trailblazer in terms of freedom rights and empowerment. And this is a day of celebration that's going on an international level. And I'm truly excited to be a part of that trend on today and every day of my life. Thank you so much for joining. Please, as you come in, please share out with some friends. And I am going to share as well. It makes the difference. Sharing is caring. And when you have a message that you want to share with others, it's so good to be shared, and it's even better to share. So I'm going to share out with a few of my friends as we talk about the importance of empowerment and what that means in terms of innovation. Innovation, we have come to a time in our society where we are using the internet. The advent of the internet is at major rates. And so I'm super excited about being your evidence-based mobile social support coach. And I want to just share with you why it's important that we innovate now. We must innovate now, not tomorrow, not later, but today. Simply because we all talked about that last week, about why we need to innovate and begin to develop our own platforms to reach people where they are. So I am super excited about sharing today. It is Empowerment Day, a day that's being celebrated by everyone across the nation in terms of our great leader, Dr. Martin Luther King. And so thank you so much for being here on my Facebook live today. I am Dr. Eveangel Savage, your evidence-based mobile social support coach. And what that simply means is that I help practitioners and providers to develop their own platforms to bridge the gap in service delivery and maximize the potential of reaching people where they are. I was reading an article earlier, and it was very exciting to me to know that the cutting edge research that I had studied for the past 5 years is actually being implemented with lots of people throughout the telehealth world, throughout mental health, throughout substance abuse, throughout nursing practice, throughout many, many industries. As a human service provider, it is imperative that no matter what your industry is, that you begin to look at how you can best structure a system that is going to meet the masses. And what should that look like? It should model a pretty much your services on the ground. It should model your services on the ground. We all know, or at least the research says, that there is a greater number of people who are coming or getting service through mobile social support today now than they are through brick and mortar. And the reason why is because I'm going to keep talking about this. It's so imperative that we talk about innovation. We need to bridge the gap between IT and all of the service providers. You have a service, people need you. People are waiting for you. There is such a huge need for us to bridge the gap in services, in education, in access, more effective services. And now our governments and state agencies are now upping the ante in terms of you being able to bill your services with Medicaid, and with all of these agencies, you are now able to bill your services. So for all of the providers out there who are thinking about futuristically on building a practice out in your specialty area, there is no better time than now to begin looking at, what do I need to have in place? What kind of forum? What kind of things should I be looking for in terms of growing a population that I can serve? How do I develop a needs assessment? How can mobile social support best be utilized in my industry? Good question. Let me just share with you, there are amazing opportunities on the horizon. Thank you for joining, Trish. Thank you so much. And I'm glad you're here. I have 3 other nurses in my group right now. And what's so amazing is that they too understand that telehealth is on the rise. Our nurses they're serving people in the home. They're building mobile units. They are really blazing the trail in telehealth, in their particular specialties, in their to provide service that's accessible. Mobile units. I mean, it's amazing what is happening out here through innovation. And so the government saw this coming just as I did, just as the research was developing over the years for telehealth and telemental health, that they knew it was coming, and they had to begin to structure HIPAA laws. They had to begin to structure privacy laws. They had to begin to do all of these things so that we could be prepared for what was coming. And what we do now know is that with the healthcare system the way that it is, with the mental health system the way that it is, with the stigmas that are associated with social conditions, with limited rural access to programs, with stigma associated with people coming to programs for certain things, that there would be a need, that there would absolutely be a need to innovate now. And so because the government saw the need, hi, Andrea, thank you for joining. Because hi, Monique, thank you for joining. So glad to see you. Because the government knew that there would be a need, the evidence was being done. The research was being done to share with the public why this was important. Hello, Patricia. Thank you for joining. Great story you shared today. I just wanted you to know that I share, and it was so relatable because I too had placenta previa. And so I could really relate to your story, and thank you for sharing so much. It was just such a beautiful story on how your fruit of your labor, the fruit of your labor was the reason why you had to endure that. I too had a placenta previa, and she is now blazing the trail as a freedom fighter across the nation. So the fruit of my labor, what I went through, wasn't for me. It was for the world. What the world was going to see. It was the enemy's attack on trying to get rid of the blessing that God had for me. Okay, back to my story. The story is, I just wanted to share that with my sister. But the story is this, you guys. The evidence, if you are not operating under under evidence-based practices, please get under some tutelage. I am offering you some special opportunities to share what you're doing. What does the evidence say about your industry? If you haven't tightened your ship with that support that's supported by the evidence, whether it's the evidence in research, the evidence of the Bible, in every industry that you have, that there is evidence to support that. Now, my title says, Innovate Now. It is because the evidence says that in everything you do, in every industry across this nation, that you need to innovate. And how do you do that? You need to learn how to develop a model that's going to be conducive for you to connect with your market. If you are not doing that, then you need to find yourself a way to connect with me so that you too can develop your model. Okay. So the young ladies and the nurses and the individuals, the professionals that are in my group are small in number, but they are gaining a wealth of knowledge. They are gaining momentum in terms of how to look at a model and develop a model, because the thing you're going to take away is going to be instant gratification. How can I get started now? How can I get started now? Where do I find my target population? Where is the evidence how do I develop my needs assessment? The questions that you have can be answered within our mobile social support group, but you got to get in there to get the answers, because it's time out for us just giving away the information, because I need to teach you how to build a platform that can pay you. Listen to me. I need to show you how to build a platform that's going to pay you. Okay. So my model is a model that's going to pay me. I'm teaching you how to build a model like mine to pay you. So that's the benefit of being within this group, an evidence-based practice of mobile social support that feeds your industry and pays you as well. So if you are not in the group and you would like to be a part of my group, okay, great. You need to get in the group. And my group is tinyurl.com/97cents. The foundational principles of positioning yourself are being taught, and they're being taught right now. Okay? They're being taught right now. So if you have an interest of developing a platform that's going to pay you, yes, a landing page. Yes, that's going to be my next demo. Actually, my next workshop. So the thing is, you have to build, and there are tools that are being taught within my group that you need to use, and you need to use them now, because you need to innovate. You need to innovate your platform so that you can meet. What was the URL? It's tinyurl.com/97cents. Somebody put that link in the chat room for me. Very, very critical. If you want some supercalifragilistic moments today, these moments are empowerment moments. That's your supercalifragilistic moment for today. Empower yourself, empower your community, and prepare to get paid in a different way. Nurses are being paid through this program. Human service professionals are being paid through building of mobile social support. Industry leaders all over are being paid by developing models that are going to support their constituency, because first and foremost, you have to have a reason. You have to have a reason to be serving. If you are in an industry where you are wanting to save a life, whether that's through your words, whether that's as a speaker, whether that's as a provider, as a mental health provider, as a leader, as a nurse, as a doctor, whatever your industry is, you must begin to develop and innovate now. Innovate now. What will I be giving you alongside that? Alongside that, I'll be giving you the social practices that's going to help you to build your profile in a way that you are authentically built within a system. I will also be sharing my beautiful model with you as we grow together. And third, I'm going to show you how to dig in that evidence that's going to help you with the 80%, 20%. 80% marketing and 20% service. 80%, 20%. Hello, Sarah from the UK. I thank you for joining. Thank you to my sister from Korea who's here with us as well. Thank you to my sister tribe who is also here as well. Thank you to my Philippi family who is also here as well. I appreciate you. Please share this with your followers because there is no greater time than now. If you haven't shared yet, push that little button down there, that little man down there with the plus sign, and share this message with your followers because there is a great need for us to expand upon the knowledge that we know about mobile social support so that the people that we serve can be served. Now, mobile social support, everybody keeps asking the question, what is mobile social support? The definition says it's any process through which social relationships might promote health and well-being in a mobile environment. That is what this is about. So if you are an industry leader, it is critical that you get into this. Hello, and thank you, Sarah Ahmad. I appreciate you. Get in and begin to build your systems. I am going to be doing webinars. I am going to be showing you how to get into the evidence. I am going to show you how to build your business. Build mobile social support as a business. Build it as a business. Build your business in a mobile social support environment. Even if you're still on your job, now is the time to begin. I began this process before I left my job. I began this process again before I left my job. It took me 5 years. It doesn't have to take you 5 because you have a very knowledgeable leader in the mobile social support industry who's willing to teach you everything that she knows. My name is Dr. Eveangel Savage. I am your evidence-based mobile social support coach. I teach you how to capacity build and bridge the gap to your services by building your own mobile social support groups and helping you to find the evidence to support the reason why you are necessary. Why are you necessary? If you don't know why you are necessary and you need to begin to develop your needs assessment around your particular specialty, we teach that. I teach that. So this is what I want you to know. You don't have to have it all together. You have to have a need. You have to have a desire to want to innovate. And the way you empower people today is to innovate because they are in front of these mobile phones. Let me tell you, they're not opening the doors anymore. They're not walking into the brick and mortars. The people who are going to walk in there are your traditional folks. That's fine. They're going to stay there. You still have to serve them. But if you want to reach the masses, in your industry, then you must cross those boundaries and don't be afraid. Don't be afraid to innovate. Absolutely necessary. Thank you, ladies, for that comment. I appreciate it. Absolutely necessary for you all to innovate now. So if you're ready, get in there. Let's get moving. I just started my group last week. Didn't even realize just how important this, God will open up a blessing, open up his heavens and pour you out a blessing. And when he says move, he means move, and he means move right now. He told me to move right now. You are equipped with everything you need to teach the world about mobile social support. You are ready to cross continents. You are ready to serve a nation of people. And so I'm telling you, just as he has told me, if you have a niche market and you are ready to serve your nation, then develop your platform, your mobile social support platform that is not only going to allow you to serve your industry, but it's going to allow you to create residual income that you can make money while you're asleep. Make the money. Thank you so much, sis. I appreciate you. Make the money while you sleep. So the nurse, a nurse asked me yesterday. She had that very same question. Thank you so much, Sarah. She said, "How can I make the money while I'm asleep?" She has a mobile unit business. She's a mobile nurse. She's traveling, and she does a lot of her business. She's developing a great business. It's amazing how much I learned from her just having a clarity call with her. She said, "I want to know how to integrate. I want to know how to integrate mobile social support into my business." And so she took up a clarity call. Professional nurse, been a nurse for a long time, nurse practitioner, and she wanted to know how she could integrate mobile social support in her business because she has a mobile business. And so, lo and behold, it was the best conversation I have had in a long time in terms of why this is important. Innovate now, folks. I can't give you all of my secret sauce right here on Facebook Live, but if you are willing to take the risk with me, I'm willing to take the journey with you. If you're willing to take the risk with me, I am willing to take the journey with you to develop your platform for mobile social support. But it begins by aligning yourself in a mobile space, aligning yourself across these internet spaces and platforms in a way that allows you to develop yourself authentically in your industry, how to connect with your market, how to find your evidence, how to market yourself as an industry leader, how to do these things 80-20, how to serve your population. So if you're not there yet, get inside the group, folks. Let's make it happen for you. This is your supercalifragilistic moment of empowerment today. Make it happen. There's a nation of people who are waiting for you. And I'm waiting for you too. This is Dr. Eveangel Savage, your evidence-based mobile social support coach, and supercalifragilistic moments right here on my channel. Thank you for joining, and I will see you again on tomorrow. Have a great day, everyone. You are amazing. And go out and serve someone today on this national holiday of service for Dr. Martin Luther King. Thank you, everyone.